So through the Castleman Disease Collaborative Network, we did two things that I think were really quite innovative. One is that we decided that we weren't just going to raise money and then hope that the right researcher applied for the right project at the right time, which is sort of typically how research is done for rare diseases. We said, okay, we're going to connect with physicians, researchers, and patients, and we're going to ask them what research should be done. And then we're going to go out and we're going to find the best researcher in the world to do those studies, and we're going to fund them, we're going to give them samples. And so it's sort of like a way to go from this sort of reactive model to a proactive model. And we call it the collaborative network approach because it's really all about collaboration and working together. So that was one thing. We said, okay, we're going to do this in a collaborative, this collaborative network approach. The other thing we said was, we don't have $1 billion in 10 years to create a new drug from scratch. If we want to make a difference, a meaningful difference for patients in the near term that can maybe help me and other patients with my disease, we're going to need to get involved in drug repurposing, meaning we're going to need to figure out what is going wrong in the disease and then see, is there a drug that already exists for another disease that could be repurposed for my disease? And that second realization, or the second sort of decision, was based on the realization that those chemotherapies I got that saved my life, they weren't made for Castleman disease, but they worked to save my life. And so it was like, well, wait a minute, are there other drugs like these chemotherapies that could actually save my life? And the chemo didn't work long term, but it clearly worked in the short term. And I also learned that there were drugs that were made for Castleman disease that were being used for other diseases like rheumatoid arthritis. And I was like, well, wait a minute, if Castleman's drug can be used for rheumatoid arthritis, maybe there's a rheumatoid arthritis drug that can be used for Castleman's, right? And so that's what our second thing was, is to really focus on drug repurposing and from building the collaborative approach and then pursuing drug repurposing. About 3 years into my journey with Castleman's, I ended up discovering a drug called sirolimus, which was made for organ transplant rejection. I thought it could work for Castleman's, and I started testing it on myself as the first patient ever with Castleman disease to receive sirolimus. And as you said at the beginning of our conversation, January 5th marked 10 years in remission, and July 5th marks 10 and a half years in remission.